Hi everyone, you're listening to the Health and Wellbeing Podcast. I'm Alison Mitchell, a practicing naturopath, and you can find me on naturopathnSW.com.au. These podcasts will feature discussions on various health conditions, health tips, and nutrition from a naturopathic perspective. Sometimes it's just me, sometimes I'm interviewing guests. All the time, I hope to share with you information on health and wellbeing with the aim to empower and educate. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. Hi everyone, welcome to Pregnancy Part 2. I'm Alison Mitchell and I'm joined with Kellie Holland from Tonik Health today. And so today we're continuing on from the last podcast and video recording that we were doing. So in that one we talked about nutrients for pregnancy, and we had also started to talk about some different conditions that can affect your health during pregnancy as well, such as gestational diabetes, preeclampsia and fluid retention. So we're going to be continuing on from that today. And the first one that we're going to start talking about now is the importance of being conscious of Listeria contamination in your foods. So do you want to talk about that, Kellie?
Yeah, sure. So pretty much everyone knows that when you're pregnant you should avoid certain things. There is a long list of a long list of foods that you should probably avoid, but specifically for Listeria you should probably avoid raw meats, deli meats as well. Make sure you're washing your vegetables before you eat them. Don't buy prepackaged salads from Woolworths. Just make sure that you're making your own as well. Check your use-by dates as well. That's a big one. And yeah, like soft cheeses and thoroughly cook your meat. You got anything to add?
Yeah, no, that's true. Although I don't find that you need to have your steak well done.
No,
you can still have it so that it tastes good, and a lot of people do sort of freak out about that. But definitely no steak tartare or carpaccio.
Yeah, no blue meats.
Yeah, but medium rare, that's fine.
Yeah,
because it's still going to be heated through. Because the main thing is that it is going to be heat. If you're heating the food, then the Listeria is going to be killed off. So that's all good.
Make sure you cook it.
Yeah.
So it's fine. Yeah.
And a lot of the foods that they do talk about being your common ones for contamination as well, like your seafoods. If you're cooking it yourself, then it's fine. It's just that if it's sort of been sitting there for a while, then that's when you want to be a bit sus about it.
Yeah.
Thankfully in Australia our actual rates of Listeria problems are really low. However, we still just have to put that recommendation out there to be conscious of it, because it's better to be safe than sorry. And I actually think that what you were saying as well about the salads and things like that, that's actually probably more of a concern than a lot of the meats, because in America, most of the Listeria contamination is actually from supermarket spinach, rather than cheeses and things like that.
Yeah, that's a bit scary.
Yeah. I was reading an article the other day that was talking about how, if you eat a salad, so say you're in France and you're pregnant, you actually get more frowned on for having a salad than you would for having a glass of wine. Just different cultures, understandings of what's acceptable during pregnancy and that sort of thing.
Funny.
Yeah.
Oh, it's so funny.
Okay, so another problem that can affect a lot of women during pregnancy is fatigue. So this can be most common in the first trimester, but then it can start to creep in again in the third trimester as well. And in the first trimester, unfortunately, you do know that you've just got to rest.
Yeah.
Because a lot of the time it's your body's actually saying, hey, I'm making a baby right now. You need to chill out a bit. Yeah. And particularly if you are that sort of rush personality, that might be your body telling you that you need to slow down.
Yeah, definitely. Even when you're not pregnant, that's your body telling you to slow down.
Yeah, exactly.
Yeah, I find there's a lot of people, especially when they get sick as well, they don't allow themselves to just rest and recuperate, and the body does need that rest time, so it's using its energy to heal or make a baby and not, bombarding it with other chores to do.
Yeah, that's it. And what might be happening is that you just need to maybe have more nutrient dense foods and also be conscious that you are eating enough. You don't have to eat a huge amount in that initial stage of pregnancies because your calorie requirements only increase by a little bit, but it is still something to consider because we do. I know in clinic I see a lot of people doing like the 1,200 calorie diets, and that's just not enough for what
that
you
worries
do.
me. But as well, on the complete opposite of that scale is people use the whole I'm eating for two as an excuse to gorge themselves on food as well. And you're not actually eating for two, you're eating for 1 and a 12th. So yeah, you don't need too many more calories later on in pregnancy, but and it's the type of calories you choose as well, which make a big difference.
Yeah, and if you're eating a lot of junk food, then that in itself can make you feel tired.
Yeah, definitely, because you have that crash.
Yeah, that's true. So the first thing I would usually suggest for someone who's experiencing fatigue in pregnancy is to rest, and then to amp up your nutrient-dense foods. And then if it continues to be the case, then we might be able to look at herbs like withania that can help with stress levels and adaptogens, so that can sometimes boost up fatigue. But a lot of the time it will pass, and by the time that you get towards the end of the first trimester into the second trimester, fatigue does really start to dissipate. And then in the third trimester, towards the very end, it's common to feel fatigued again. And that is because your body is under a lot more strain at that point, in which point you should start to be winding down anyway and building up your reserves for the birth. And then right before the birth, you usually get an energy spike, in which case you start cleaning the house madly. That's referred to as nesting. And in which case, you know that the baby's probably coming a bit soon.
Yep. Oh yeah, I don't miss the nesting phase, that's for sure.
How long did the nesting phase last for you?
I think I started around 35 weeks, I think, maybe even a bit earlier, and it was ridiculous. I'd get up at about 3 or 4 in the morning and just feel like I needed to scrub the grill or scrub the laundry, you know. It was ridiculous.
Well, I found myself randomly cleaning the oven yesterday with my bicarb and vinegar, and I'm like going, oh, is this nesting?
Yeah, that's
Jim walked in
exciting.
and he's like, what are you doing?
Yeah, it's not clean enough.
No. Okay, so moving on from that then, do you have anything else to add?
No, you pretty much covered it, yeah.
Yeah, okay. So another common condition that a lot of women experience during pregnancy is urinary tract infections. So this is pretty common because during pregnancy, the hormones cause the ureters to relax, and so then that allows the bladder, or the urine to flow back up from the bladder where it's no longer sterile into the kidneys, which can be problematic. But it also does allow the urethra itself to relax, so there can be some cross-contamination of bacteria going from external up into the bladder. And sometimes when you do have a bit of a higher blood sugar level as well, that can predispose you to getting some urinary tract infections as well. On top of that, your immune system is completely different during pregnancy too, because it has to shift to allow this baby to grow, which is a foreign object. So it's no wonder that we are much more likely to have that happen. So one of the things that you can do is really just work on having lots and lots of water. But cranberry juice is really good as well, because the cranberry juice helps to stop the E. coli from adhering to the bladder walls, so that when you do go to the toilet, it eliminates, and your immune system is actually able to deal with it more effectively as well.
Yeah, no, definitely. And making sure that you're keeping the genital area clean as well. Showering often. I find that when I was pregnant, I just could not be bothered, but I sort of forced myself to because I had frequent urinary tract infections. But also, as you said, refined sugar and refined carbohydrates plays a big part as well. When you've got a diet that's rich in those, I find that the frequency goes up. And also, I don't think I have to say it, but always wipe from front to back, not from back to front. That's something I've had to teach my daughter because it's just awful. So, and when you need to as well, if you feel like you need to go, don't just say, oh, I'll go later. Do it then. Don't delay. And as much as if you've got a urinary tract infection and when you're pregnant, you really don't want to drink a lot of water because you're always weeing. And with a urinary tract infection, weeing hurts. But drinking plenty of water is also pretty important as well.
Yeah. And when you get further along as well, the weight of the baby will also be compressing the bladder so that it doesn't empty properly.
Yeah.
And sometimes what can happen as well is, like I've spoken to some of the osteopaths at my clinic about this, is that the pressure on your lower back means that the nerve signal to the bladder isn't going to be as good.
Oh,
And
that's
so,
interesting.
yeah, and so then that means the elimination isn't as good as well.
Yeah.
So there are things that you can do with your diet, and then there are things that you can do herbally as well. There are some really safe herbs that you can take to help, and definitely cranberry juice as a number one for prevention. And there are tablets that you can take that are cranberry as well. Probiotics.
Yay!
You love your probiotics.
Yeah, the lactobacillus species are really good for
Yeah.
urinary tract infections.
Yeah, and there is some research that shows that taking D-mannose, which is from cranberry, is really helpful. The safety studies of that in pregnancy haven't really been done. So a lot of the time the recommendation is to do it from the whole food. But it's out there, and it may become more commonplace for this recommendation to be later on. And definitely see someone who can help you if you've got any sort of musculoskeletal issues, like an osteopath or a chiropractor, like whatever you tend to find the most benefit from. And in a lot of women as well, like you during pregnancy, you may not even actually have symptoms of a urinary tract infection. You can get an asymptomatic infection as well. And so that's why when like the midwives or the obstetrician would do a urine test with you. And so they don't really want that to get too bad, because unfortunately with your urinary tract infections, it can lead to pyelonephritis.
Yeah.
That's a bit of a mouthful. And then, and if that is quite bad early on, particularly before like 24 weeks or so, then that can lead to miscarriage.
Yeah.
However, taking steps to prevent it is your preference, rather than having to take antibiotics, because antibiotics have their own sort of consequences as well. However, E. coli infections are associated with eczema in newborn babies, just as much as having not enough good bacteria is. So you've got to deal with it.
That's interesting. I didn't even know that. That's interesting.
Yeah.
Yeah. Okay. Cool. Yeah, and definitely I agree with the frequent urine testing. I mean, it's non-invasive, and just make sure that you push for it, because I had a midwife that didn't think it was necessary, and I knew for a fact that I had proteinuria, and I told her to test me and she didn't. So 4 weeks went by with 4 consultations and she didn't test me, and it turned out I had preeclampsia. So yeah, so definitely push for the urine testing. It doesn't take long. I mean, we is free, so just push for it.
How funny. You may even be able to find some dipsticks from the chemist that you could get as well, and do it yourself if you're concerned and you don't have a cooperative healthcare practitioner.
Yeah. Yeah, exactly.
Okay, what about mood swings in pregnancy? Was that something you ever experienced?
Yes, definitely. I was more weepy than angry. I don't get angry often, but yeah, that's a tough one. Again, a balanced diet helps, because if you've got those beautiful nutrients in your diet, then you're less likely to have those mood swings. But I mean, you're pregnant, your hormones are doing lots of fun backflips here and there. So I would definitely be liver support. Liver support is big because, as you know, the liver metabolizes hormones the same way as it does alcohol. So supporting that liver is really important. Plenty of your greens in your diet. Make sure that you're slightly cooking your brassica vegetables like broccoli, kale, all that sort of thing. Yeah, well, Hormones are just,
Yeah.
I mean, that's just a part of pregnancy really, but
Definitely agree the liver stuff, but
yeah.
also, making sure you're getting your nutrients. And you were talking about the importance of magnesium before in the
Oh
last
yeah,
podcast, and
definitely.
that's one that's pretty important that a lot of people tend to go through really quickly. And
Yeah.
calcium and your B vitamins, as you said, if you're
Mm.
eating lots of your veggies, then that should be okay.
Yeah.
And there's some herbs that are safe to take during pregnancy as well if it's bothering you. So you
Yeah.
could see a practitioner for that. And
Yeah.
also incorporating mindfulness and meditation and yoga, those sorts of things can be helpful as well. But
Yeah.
it is an emotional time because if it's your first one, your whole life is about to change, and if it's your second one, you're probably still going to have a lot of change, and then you've got all the hormones on top of that as well. So.
Yeah.
But the way that the hormones can make you feel really does have a lot to do with your state of nutrients to begin with anyway, such as your zinc and your vitamin B6 and, as you said, your liver function. So I think that getting that on track, if you know that you've got a lot of PMS before you fall pregnant, like getting your nutrients sorted and your liver a bit healthier can be helpful.
And your thyroid too, I've
Oh,
noticed
yeah.
that
Yeah,
people with
definitely.
thyroid issues, yeah, and even, I mean, this is off topic, but people with women with thyroid issues are more likely to have severe menopause symptoms. So it sort of works the same way with hormones,
Yeah, definitely.
pregnancy hormones.
And thyroid problems are often misdiagnosed as depression too. So
Yeah,
there's that.
yeah, definitely.
Okay. And constipation, another common issue for a lot of women during pregnancy.
Yeah,
And similar to the fatigue, this is actually pretty common because your body is trying to get the most out of its food. So by having more nutrient dense food, your body will hold on to things for less amount of time because it's getting it fairly readily. But as you progress further into the pregnancy, the actual compression of the intestines is going to be a factor as well. So making sure you're drinking lots of fluid and having plenty of vegetable-based fibres and good fats can be
yeah,
helpful too.
yeah, definitely. And magnesium comes into it again there too.
Yeah,
Yeah.
and
Oh,
that's
and probiotics.
of course.
Don't forget those.
Slippery elm can be helpful as well,
Yeah.
and you can take that as a capsule or a powder, or you can mix it in with food, and also keeping active and doing a bit of gentle exercise as well, because when you are getting active, then the actual movement of your legs up and down is massaging the intestines and getting
Yeah.
things moving through.
Yeah, definitely.
And then having bitter foods occasionally can be good too.
Yeah.
Yep.
Yep, lemon in water in the
Yeah,
mornings. Drink it with a straw though to save your teeth.
that's it. And along those lines, there's heartburn. So a lot of women experience heartburn during pregnancy, and it's because of the excessive progesterone causing the sphincters to relax.
Yeah.
So keeping your portion size down and your posture under control is good as well. And then, and you also just want to avoid a lot of your trigger foods as well, which is your spicy and your fatty
Oh
foods.
yeah, definitely.
And then,
And sorry,
there you
you
go.
go.
No, you
I
say.
was just going to say that the antacids are usually, it's antacids lower acidity in the digestive tract, and usually it's not a hyperacidity problem when it comes to reflux, especially in pregnancy, because as you said, it's the relaxation of the sphincters
Yeah.
really. Yeah.
Yeah, so you want to actually be getting things moving through. So chewing your food more and having smaller meals will be helpful for that, rather
Yeah.
than stopping the stomach acid production.
And propping yourself upright as well in bed instead of laying flat. Well, you're not laying flat anyway if you're that heavily pregnant, but propping yourself upright just slightly so that, your gravity is helping you along as well.
Okay, and so another common condition that a lot of women experience is thrush. And so I think we're all going to shout out now probiotics. But so probiotics is super important for keeping your gut flora and your vaginal flora healthy, but also you want to be not having too much sugar and refined carbs.
And again, hygiene is a big thing as well, and making sure that your soap isn't going to, A lot of soaps actually contribute. So washing down there, I know this sounds gross, but actually washing without soap can be beneficial for thrush than washing with soap.
I recommend not using soap down there too, because it does have its own self-cleaning system.
Yep.
And if you're looking after it from the inside, then it will do its job really well.
Yeah, exactly. You said it perfectly.
But just be conscious of sugar-containing foods like pasta sauces and a lot of packet foods and things like that, because that's where a lot of sugar gets snuck into the diet, and that's not what we want. Okay, so we've got a couple of questions that we can answer before we finish up today. Yep. So one is, what can we do for coughs and colds during pregnancy? So usually what I would recommend for that is to have vitamin C and zinc, and there's a few herbs that are safe. There's a formula called Sinupret, which is available over the counter now, which is quite good for respiratory conditions. But if you do see a practitioner, they'll be able to give you an individualised formula of herbs that are safe, and making sure that you're taking your rest and you're drinking your fluids and things like that is one of the best things to do. We've spoken about it before, but you don't want to take antibiotics if you can avoid it during pregnancy, because the gut flora is really important. And a lot of your cough and cold medications you definitely need to steer clear of during pregnancy as well.
Yeah, agreed, definitely. And probiotics, well,
of course,
for cold and flu.
How could I forget?
Exactly. Yeah, no, probiotics, and making sure again that you're making sure you're getting the correct strains and not just getting any product at all. And a naturopath can help you with that. If you go to a health food store, make sure you look on the label. Usually the strain is in a bracket or just a random amount of letters and numbers. Yeah, it looks a bit strange, but yeah, it should say Lactobacillus acidophilus NCFM, or it should have 3 different things, because then you don't know what you're getting if you don't have that strain.
Yeah. Okay. And then the other one is, the other question is, can I have green tea during pregnancy? So this is a good question, because caffeine in pregnancy is something that a lot of people do wonder about.
Yeah.
And so the recommendation is that you shouldn't have more than 200 milligrams of caffeine a day. This is different for everyone though, because if you have a higher risk of miscarriage or preeclampsia or heart problems, stress, anything along those lines, you may actually find that you will be more sensitive to caffeine. So cutting it down further than that could be helpful. However, if you don't have any of those risk factors, then the amount of caffeine that would be about 200 milligrams would be like 1 to 2 cups of coffee a day. And in terms of green tea, that's 4 cups of green tea.
Yeah.
However,
sorry. No, sorry, I was just saying that I remember reading a study that they did on caffeine, and that, I mean, as you know, caffeine crosses the placenta and the baby can't metabolize the caffeine properly because it's still developing. And there were studies that actually showed that even under 200 milligrams a day of caffeine caused small birth weight.
Yeah.
Yeah, so I mean, and it's also related to retardation, stillbirth, miscarriage. I mean, it's hard if you're a complete coffee addict. It's hard to say don't have any at all, but I mean, having as little as possible is always best.
Yeah. And the other thing is that in a lot of the coffees, the caffeine content varies a lot too.
Yeah, definitely.
So you may find that you can have a cup of coffee and it's hardly anything. Whereas a coffee can have from anywhere between 80 to 350 milligrams of caffeine in there.
Yeah.
So
yeah, it's really hard.
Yeah. So I think just you've also got to know how you feel as well. Like if you feel like you're sensitive to caffeine, then you have to back off. Whereas some people who metabolize caffeine really well, they're not going to have as much of an issue.
Yeah, exactly.
And then the other question was, when do I have to stop lying on my back during pregnancy?
Yeah.
this is basically it's because the weight of the placenta and the baby will compress the uterine artery or the artery in the abdomen, and that can reduce blood flow to you. So if you're lying on your back and you're feeling okay, then it's fine. So most people recommend that you would want to stop lying on your back by around 30 weeks, because that's when you start to get a lot bigger. But you may actually find that you still feel okay during that time. However, in the last 6 weeks, that's when you really want to be careful that you're not doing it then. They talk about lying on your left side as being beneficial. However, and that is because the left uterine artery is stronger than the right one, only slightly though. So that again depends on you and the health of your baby. But if you're lying on your back and you start to feel nauseous, then that's a sign that, that's not for you. But as soon as you get up, you're going to feel better.
Yeah, definitely. And another reason why they say the left side is because it keeps the heavy uterus off the liver as well. And so it sort of promotes the most oxygen and nutrients to the baby. And you're absolutely right with the weight of the uterus on the inferior vena cava, which is the one, and it actually promotes, if you've got weight on it, they say it promotes less oxygen and nutrients to the baby as well. So I agree with you. If you're feeling dizzy, if you're laying on your back and you're uncomfortable, then it's time to find another position.
Okay. Yeah, great. All right, so we're about to wrap up. So we'll just finish with a few things that you can do to prepare yourself for labour and some resources for pregnancy. So in terms of labour preparation, there's lots of different birthing classes that can be helpful for you. I'm currently doing hypnobirthing, which is also known as the Mongan method, and I'm finding that really enjoyable. But there are a lot of other ones out there, such as your calm birth. What did you do?
I didn't do anything actually, unfortunately. I wish I did the hypnobirthing and the calm birthing, but it's funny because when I was in labour and I was in a lot of pain and everything, I started to do breathing. I actually explained it to a doula afterwards, and she said that is exactly calm birth.
Wow.
So yeah, I actually started doing the breathing, and the pains were just getting basically nothing. And the midwife actually said, "I know you're having a contraction, so don't tell me that you're not feeling pain." Like she was getting quite cranky with me, and she actually threatened me with a cesarean if I didn't start feeling pain again. So yeah, even that's an awful story, but she wanted me to push, and I said, "I don't feel like pushing. I'm not in pain at the moment." So I'm just saying that, yeah, the calm birthing and the breathing is surprisingly such a great pain relief in labour. And if you can manage to sort of distance yourself away from the pain and come back to your breath, it's actually quite beneficial and really powerful too. I was surprised. But yeah, and also looking into hiring a doula, because doulas are fantastic when it comes to birthing and making sure that you're getting the birth that you want as well. Because when you're in labour, I mean, you're sort of on another planet, and it's good to have someone there for you to say to the midwives, no, this is the birth she wants, or, you know, making sure that you're getting the experience that you're after and making sure you're comfortable as well.
Yeah, definitely. It's interesting with the hypnobirthing, what they talk about as well is that birth doesn't necessarily have to be as painful as Hollywood and like a lot of your friends and family will tell you that it should be. And the theory behind like birth being painful only really came around in the 20th century AD when that's when the whole like anti-women thing started coming about in the medical society, and they talk about painful birth being Eve's curse, whereas there's numerous references in the Bible of like healthy, like pain-free births. And what I'm reading is very exciting, because if it can just be felt as pressure rather than pain, that's obviously like a better thing to do. But yeah, we'll see.
Yeah, you have to let us know how you go.
Yeah. In terms of the labour preparation and things as well, one of the other things I would suggest is to practice squatting beforehand, and so you can get the muscles in your glutes and your lower back strong, because upright births, such as in the squatting position, on all fours or assisted squatting, tend to have a less risk of fetal
Complications.
When they're upset.
Distress.
Yeah, okay. Yeah. They have less risk of fetal distress, and also it has less uneven pressure on the perineum, so there's less likelihood of tearing and need for an episiotomy, and it tends to be much more of an easier labour rather than when you're lying in a semi-reclined position, such as on your back, when the pelvis can be actually closed by 30% in that position compared to in an upright position. Yeah.
Gravity works.
Definitely. And this is a traditional position that a lot of women have birthed in older cultures, and so that squatting position, leaning against a wall or on all fours, or on your partner as well. And I think having your partner there and having them involved and educated about the birth is going to be such an important thing, because then they can support you, similar to how like a doula would protect your interests. Your birth partner should be able to do that as well, but they need to have that confidence to speak up, and so getting educated is the way to do that.
Yeah, and that's what doulas are fantastic for that too, because they consult with the mother and the father as well, and they give the father tools to get that confidence going as well.
Yeah. And in terms of books, these are I've got a few books that I've been recommending or enjoying. So this one is by Francesca Naish and Jeanette Roberts, The Natural Guide to Better Birth and Bonding. And
I love Francesca Naish.
Yeah. And similarly, The Natural Way to a Better Pregnancy.
Yeah, cool.
She's got a few other books as well on breastfeeding, and there's one called Natural Way to Better Babies, which is about preconception care, and also the Natural Guide to Natural Fertility. So she's got a few books out there, so it's a really good resource.
She's awesome, yeah.
And for the birth itself, this is a good one.
Cool.
Active Birth, and that one talks about, that has it's a very 70s picture book in there as well, but it has a lot of diagrams and pictures for the actual birth itself.
Yeah, okay.
So, actually, I won't show them to you because they've got some.
Oh, yeah, I've just got the one. I didn't have this when I was pregnant or giving birth, but because I actually studied to be a doula, I don't actually do doulaing anymore, but I bought it to sort of educate myself for my patients. It's called Gentle Birth, Gentle Mothering, and it's by Dr. Sarah Buckley. And she's actually an MD, and she works a lot with pregnant women, and it's fantastic because she's a doctor, yet she actually uses her brain when it comes to everything. Like she questions everything, and if there's not enough scientific data to back up things, she questions it. That's what I like about her, because she's very
That's what you want.
Yeah, definitely.
Yeah.
So yeah, she's great.
And I've also got this is the hypnobirthing book, which is a good resource, the Mongan method.
I'm looking forward to hearing how that goes.
Yeah, well, I'm actually pretty excited.
Oh, nice.
Because it's about creating a positive feel about it and removing fear.
And that's how it should be. It's totally how it should be.
Are there any other resources that you recommend?
Not offhand. I mean, if you are looking to get into a doula, like if you're looking to hire a doula, there's findadoula.com.au. I think it's a .au. And there's heaps and heaps of doulas who have their profiles up there, and it's all about sort of finding one that you resonate with. And I mean, the first interview with your doula is free, so feel free to interview as many as you like and make sure you find one that's good for you. But apart from that, not really, no. Just get a good naturopath that has an interest in pregnancy and birthing.
Okay. And I think as well, looking at breastfeeding resources earlier on is good as well. So maybe joining the Australian Breastfeeding Association and getting into a class before you actually give birth. I'm an infant massage instructor, and I do think that it's valuable to have that skill set before you do deliver the baby, and you can learn to actually do the massage on the dolls, because when you've had the baby, you probably have a lot of stuff going on.
Yeah, exactly.
And then also, like, getting a relationship with an acupuncturist can be helpful as well, because acupuncture can be really, really beneficial, and it can be helpful for like bringing on a labour if you're going overdue or you need to for some reason as well. And it does that in a less painful way than normal induction can.
Yeah.
And I guess from there, raspberry leaf.
I love it. Love raspberry leaf.
So, of course, we've got to finish off with our favourite herbs for pregnancy. So raspberry leaf is probably number one. And I think it's important to remember that it's not actually going to bring on labour.
No.
It's a toner rather than a stimulant.
Yeah.
But you can start it like in the start of your third trimester. You can even start it earlier on if you don't have uterine irritability. And if you do have a weak uterus, then it is better to start it earlier. And I usually recommend it in the form of a tea earlier on, and then you can get a stronger form later.
Yeah, definitely. And I think the tea is... the recommendation is 4 to 8 grams of tea 3 times daily. So that's a lot of tea, but...
Yeah, you probably don't need that much if you're starting from like your 20th week or something.
Exactly. And I would count that towards your water intake too, because you'd be peeing like nothing else if you didn't. And you don't want to overload your kidneys either. But I agree. The tea is great because... it gets the woman's hydration up as well. But the only thing with the tea is it does contain tannins, and you don't really want to have it around your meals, because tannins actually block the absorption of minerals such as iron and stuff like that. So that's why I kind of prefer the tablets or the liquid extract with the alcohol burnt off later on down the track, because I do like to make sure that the woman's getting all of her minerals as well.
Yeah. All right. Well, that's great. So thanks everyone for listening. So if you want to get in contact with me, you can find me on my website, naturopathinsw.com.au.
And you can find me at www.tonikhealth.com.au, tonic with a K.
Awesome. So thanks so much for joining us today, Kelly, and thanks everyone for listening. So bye everyone.
See ya.